Hey guys, it's Dr. Lisa here on this awesome Wednesday, joining you as we navigate through this COVID-19 craziness together. I am a functioning internal medicine doc with a huge practice in Tampa, Florida, and I love sharing with you my insights, the science that I think is most relevant, along with some tips for you to do at home and a daily affirmation. So you may see some distracting balloons behind me. It's a big birthday of mine coming up on Friday. Check out my posts. They're coming with some words of wisdom through this lifetime that I have been gifted with. So today I really wanted to discuss antibody testing. This is a super hot topic and one that I've been waiting for and my patients have been waiting for, so that we can move forward in our knowledge about this virus. So the antibody testing is becoming more and more widely available, and what we're finding is that Quest and LabCorp, which is what I was personally waiting for to see in terms of insurance coverage, is now saying that they have the tests available, which was fantastic. We just got that news a couple of days ago, and we are trying to get pricing, which is where the hedging is coming. So not knowing yet if insurances are going to be paying for antibody testing is a sticking point. Back about a few weeks ago, I was called by a colleague saying that they had access to some tests and that we could sell them out of our office. And I was very hesitant because anytime there is a financial incentive, I always want to make sure that the testing is going to be the highest quality. So I know there have been some concerns and questions in terms of which test is the best one. And again, this is not for the actual virus. What we're speaking about now is antibody testing, which means blood tests looking for something called IgM and IgG antibodies. Those are produced when you are exposed to different infections. So this is not something that's just for coronavirus or COVID-19. This is something that any type of infection can give, or many types of infections can give you antibody response, and if we had the test, you could test for them. So with this particular one, it's kind of tricky because there are many coronaviruses. So many of the common colds that we all get throughout our lifetime may have actually caused an antibody response to a strain of coronavirus. So why these types of tests are taking so long and why there's some question about their accuracy has to do with the fact that that scientists are trying to be very specific. They have to be exact that this is the specific SARS-CoV-19 strain that we're dealing with today. So what I've done is I've waited for one of the companies that I really trust. So there is diagnostic laboratories that we're going to be working with, along with, again, Quest and LabCorp, once I can get a hard answer on how much will be covered versus how much the patient's responsibility may be. And then it'll be nice to find out whether or not you have been exposed. So many of us, my colleagues, my patients, my friends, even me, have had some strange infections over the past, let's say, 6 months, maybe starting in the fall last year, where we felt sicker than typical, or something lagged on, or a much higher fever, and we're all wondering if that could have been COVID-19. So when we get this test, what we would expect if you thought that you were sick, maybe a month or two ago, probably takes about, nobody really knows how long it takes to transition from the acute antibody, which is called IgM. So that's the one that kicks up relatively quickly after exposure to a virus. And then the longer acting, which shows immunity, is called IgG. So when any of you go to get this test, and they are now also offering at-home testing, again, I would recommend going through a healthcare practitioner at this point. Let us determine which test is both the most accurate and the most cost-effective for you. That's what I'm actively doing day to day right now, and as soon as I have a hardcore answer that I'm really comfortable with, I will be sure to share it with you guys. So when you get the results back, there's going to be probably three main options of results that you're going to see. You're either going to be negative for either type of antibody, meaning that you have not been exposed, have not likely been exposed yet, or you will have a test that shows IgM positive and IgG negative. What that means is you've had a relatively recent exposure, and again, nobody knows exactly how long it takes to transition from an IgM positive into IgG immunity. So in that case, you would want to be a little more cautious because you haven't developed the IgG soldiers yet that can kind of keep you protected and immune. And we also wouldn't know, if you still are IgM positive, your level of infectious potential to other people. So that would be the second result you could get. And then the third result, which would be probably the one that most of us would be hoping for, would be a positive IgG and nothing else, no IgM. And that would mean that, at least as far as the test can tell, you had been exposed to coronavirus or COVID-19, you have been able to fight it off, and you've even been able to form these soldiers, the protein antibodies that can go after it if you were to be exposed again. There have been some suggestions and concerns that maybe this immune IgG that you would develop would not be long-term. How long does it last? Does it cover coronaviruses that may be slightly shifted in or ones that have mutated to a different form? We don't know the answer to all of that. We're going to have to just see as it plays out over time. But for now, positive IgG would be a pretty great place to be. You could feel a little bit more comfortable being out at work, going and doing things, engaging with others. So what this made me think about in terms of you at home and an actionable step is that here we are, waiting for some information, and then we've got sort of three options of how it may play out. And it made me think about conversations that I have with a lot of my patients on a day-to-day basis. And that is when you start to come back into yourself, when you start to feel things and release things and speak your truth and kind of own some self-care and self-love. If you have not traditionally had boundaries and you start looking within and saying yes, maybe when you haven't before, or saying no when you haven't before, or just speaking out about how you truly feel from a place of kindness, it doesn't need to be from a negative place, that often those around you will react. And sometimes it's pretty significant and severe reaction. So I give the analogy of a hurricane. So if you are calm in the eye and the reactivity of others is spinning around, can you stay in that centered place? So how I'm tying this back to the antibody testing is that it doesn't just apply to the reactivity of others. What about your own thoughts and your own life right now? So the situation for many of us, it has become exhausting. We are getting tired of not being around family and friends. We want to get back to normalcy. We want to go out and do things, right? So feeling like this IgG, once we get our hands on it, oh my God, I can be back to going and doing, and everything will be like it used to be. And then I want you to think about how will you react if that's not you? Let's say you've not been exposed, or maybe you've been recently exposed. What's going to go on in your inner world? Is that going to be a whole big hurricane of, oh my God, now this is never gonna end. I can't believe I thought I had that. I'm so mad at myself. So that's where we're gifted some time right now, okay? So stay with me here. What I want you to understand is situations and thoughts and people should not have the ability to suck you into the hurricane. You need to stay centered, stay calm. If your antibody test is not positive yet, at some point we're going to have a cure, we're going to have a treatment. just build your immunity, because if you get exposed, you'll be able to handle it, most of us, very high percentage of us, without significant issue. So I'll end. Thank you for listening. Thank you for joining me. Check out my post. It's super heartfelt. I'm going to be leaving about my birthday today. My birthday is not till Friday, but I really wanted to share some deep thoughts about my personal journey that I think you guys will enjoy. So to end on an affirmation, no matter what is going on externally, I have calm and peace within. No matter what is going on externally, I have calm and peace within. Thank you guys so much. Have a wonderful Wednesday. I'll be sure to get to you the antibody testing I like the most as soon as I have it. And we'll see you tomorrow. Bye for now.